Hi, I'm Joanne Cannon. I'm the healthcare editor of Politico, and with me today are three of our top health writers, Paige Cunningham, Jason Millman, and David Nather. And we're going to talk a little bit about what happened in 2013 and what kind of news is in store for us on 2014. Okay, we have not had a quiet couple of months here. Jason, catch us up on what happened on October 1st and how was it different than what we expected was going to happen October 1st?
October 1st, there was not a working website, healthcare.gov, to sign up for insurance. As we're talking right now, there are still apparently issues with the website, but it has gotten better. People are signing up for insurance, but right now they're kind of working out a kink at the moment. But you know, there's still 3 more months for people to get signed up, and that's the good news.
Right. December 23rd is the sign-up deadline for January coverage, but open enrollment goes until March 31st. How were these problems, these glitches, as the administration initially called them, how were they greeted, Paige?
Well, by a lot of outcry from Republicans once they got over the government shutdown and started focusing on them. And it was kind of a mad scramble by the administration. They brought in some high-tech folks to try to take over things, to try to fix things. But ultimately, I think they had to realize, they had to be honest and admit to folks that the website really wasn't going to be working very well for a couple of months. So we saw those glitches ongoing through October and November. And then in December, things seemed to be working better.
And was that the only problem the administration faced? A website?
No, it was not.
We only have a few minutes, so I don't know that we can list all of them, so just give us your favorites.
Well, let's see. Does anybody remember that promise? If you like your health plan, you could keep it.
I think I heard that.
Yeah. You totally could, except when you couldn't.
But now you can again, sort of.
Sort of, yeah. So it turns out that there's a subset of people who had the individual health insurance, and their policies were canceled because they wouldn't meet Obamacare standards.
Which were basically new benefits, new consumer protections.
Right, exactly.
Which some people don't necessarily want.
They were going to be beefed up, but a lot of people said, you know what, I'd like the plan I had, and I could afford that, and I can't afford this that you're offering me, or I can't sign up for it because I'm having trouble. So the administration's been scrambling ever since to try to get those replaced. It thinks it's gotten the universe of people who still need policies down to less than 500,000, but still 500,000 people.
And the Republicans are then saying that's 500,000 people, at least, they say more, losing coverage at a time we're supposed to be gaining coverage. What do we know about enrollment right now?
We know that in the federal marketplace and the state-run marketplaces, in the first 2 months, there have been 365,000 people who've signed up.
Which is better than the first day when there were 6.
First day was 6. Through the end of November, there were 365,000 in private plans. Medicaid, something like 800,000. So the Medicaid has actually been working pretty well, even though there's concerns about how the transfer of applications for Medicaid to the states is going to work out. That's been another kink.
Right, and we don't know the December enrollment figures yet. We won't know until January, but the indications that we've had so far is that there's quite a bit of an uptick, that the numbers that we get for the current month, December, probably are going to look good, but not necessarily good enough for where the administration wants to be. Paige, give us a little bit on how the Republicans, how patiently are they just watching this to all work out?
Well, sort of with the latest decision by the administration to allow people to have the hardship exemption, they're sort of continuing their narrative of this special treatment and everybody should get an exemption. That was sort of the line that you saw when the mandate was delayed for small businesses. So that's probably a line that they're going to continue pushing. And of course, now that the website's working a lot better, what they've been trying to do all along, even through the glitches, is take the focus off the website, try to make the case that there are more problems with the law that go far beyond just the website and just the technology. So they're probably going to keep focusing on canceled plans, potentially premiums, anything that they kind of draw out over the next few months.
And we should point out it's not just Republicans criticizing, and it's not just Republicans worrying. There are some Democrats on Capitol Hill who have to face the voters next year. The voters are the ones who are losing their plans. Some of the voters are losing their plans or unable to get on the website. Some of them are also going to be the people who do start getting coverage. We don't know how many people will sign up, but there are people who have their kids on it. There are people signing up. There are people who are going to have different stories to tell. They're going to get subsidized. There are going to be some happy people in the next few months. We just haven't seen as much of them. What does that do for the Democrats, or what are the risks?
Well, Democrats are pretty convinced that at some point in 2014, we don't know exactly when, the corner is going to be turned, but they still think at some point there will be people who have signed up for coverage, they're getting benefits, or they know somebody, they have a neighbor who's getting benefits or whatever. And at some point down the road, it will be harder for Republicans to keep saying we should wipe the law off the books, because then it becomes, wait, these people have gotten benefits. This cancer survivor who was uninsurable before has health insurance now. Are you going to take that insurance away from them? Democrats still think at some point they can get off the defensive on this and that things will turn around. But Republicans are still pretty convinced that, there's going to be problems with this all along the way, painful trade-offs that were not what the president and the Democrats promised. And so once you have a negative storyline, it's really hard to turn that around.
Right, and is it going to get simple? Is anybody we do this for a living, and we still get confused sometimes. What does the administration have to sort of, are there magic words? Try it, Jason, and then we're going to sign this off.
Magic words? I think if there were magic words, they probably would have figured them out by now. It's just
try it. You like it?
It's amazingly complex. There's still 3 months for people to get signed up, and of course, if you want coverage by January 1st, the timeline is a lot quicker than that. But I think the supporters of this law would really preach patience, which is something that doesn't always mesh with our mission here.
Or in Washington in general. And Paige, what do you think we're going to see in Congress when they come back in January? What are we going to, presumably we're going to hear the words train wreck and repeal, but beyond that?
Well, Speaker Boehner's been kind of coy when asked whether they are going to hold more votes. Of course, they've held more than 40 so far to repeal parts of the law. He said there are going to be more repeals, but hasn't said exactly what those will be. But certainly it seems like it's going to be a message they'll be pressing when they come back to Washington next month.
And what about replace? Are we hearing anything about replace? Are the Republicans going to try to replace this next year?
We're really not hearing it from the leadership. You do have some rank and file Republicans who have replaced plans who would like to get a vote for it. They'd like to get some more publicity, but not convinced that the Republican leadership thinks that's a good idea right now. We'll see if that pressure builds down the road, but right now Republicans would really like to keep holding the hearings about the Obamacare breakdowns. That works really well for them. It kind of fits in with their general message. This is just too big for government to attempt to do.
So this fits into a larger theme of big government, unworkable solutions. We need to do something simpler. That's what the Republicans are saying. And they're certainly genuine, as opposed to theoretical things predicting we're going wrong. Every day they can point to something, someone who's had a plan cancellation, someone who can't get online, a website that doesn't work, a price that's gone up. It's easy for them to find the problems, and it's not in the Republicans' interest. It's up to the Democrats to then find the happy stories to create a counter narrative. All right, well, we don't think that we're going to have a gentle, quiet 2014, and we will be happy to come back and tell you about our not so quiet 2014, and we hope you join us at our next conversation. Thanks.